So let's talk about anti-anxiety and hypnotic drugs. You should know all about benzodiazepines. Very, very important, used widely not only in mental health but in many other areas of nursing and medicine. So the benzodiazepines bind to the GABA receptor complex called the alpha-2, and the alpha-2 inhibits brain activity then, and it causes this calming effect. So the benzos are calming by inhibiting brain activity. So these drugs that are used for this to reduce anxiety are diazepine, clonazepam, alprazolam, and lorazepam. Not only do they help with anxiety, but they help persons to stop having seizures. It's an anticonvulsant, and it's a muscle relaxant. So the biggest thing is they are so addictive. People can get addicted to these, and they are a drug that you will find on the street for purchase. Now, of these four here you're looking at, you should note that Klonopin is the least addictive, has the least high abuse potential. And some people say it doesn't at all, but I have had several patients who have become addicted to Klonopin and abuse it as well. They have a hard time when they go off it. Now, as far as hypnotics means sleep inducing. So it's a special type of benzodiazepine that's been approved for treatment of insomnia. So it's different than the ones that we were just looking at in the previous slide. They are flurazepam, temazepam, triazolam, estazolam, and clozapam. So they're all sleeping pills, but they have the same side effects as benzodiazepines in that the decrease in motor ability, the attention and judgment are the same, and at higher doses, they're sedating. So benzodiazepines have these effects. So you have to tell patients, once you take your sleeping pill, you need to go to bed. You can't be out and around. You can't be trying to do anything that's important or signing anything or anything of any importance because you will be too sleepy and you may not be able to complete the task. So then they have something called short-acting sedative hypnotic sleep agents. These are not benzodiazepines. They're called Z-hypnotics. They also bind to the GABA receptors, but they have an affinity for alpha-1 instead of alpha-2, so they don't work with anxiety. They don't work with seizures. They don't work to reduce muscles spasms. They are only for sleep. You might know them as Lunesta, Sonata, Ambien, but if you look at their generic names, they all have a Z in them. So that's why they're called the Z hypnotics. I don't know if you've also seen on the shelves, they have now, NyQuil has something called Z-Quil. So they've taken that Z, and Benadryl actually makes you fall asleep. So they're kind of tying into the Z hypnotics, and it's really is just diphenhydramine, but they call it Z-Quil, and that's where that comes from. Now, the side effects, you have to be careful because it works fast. These help people get to sleep. This isn't people who have insomnia that wake up during the night but fall asleep okay. These are the ones who cannot fall asleep. So you have to tell them as soon as you take it, go to bed right away because they get really unsteady on their feet, ataxic gait. They also won't remember what happened for probably 10 or 15 minutes before they actually fell asleep. It has an amnesia effect. So they really need to be going to bed soon after they take this medicine. Now, what about melatonin? You hear about melatonin use for sleep, but there's also some prescription medicines called melatonin receptor agonists, which works the same basically as melatonin for sleep. Now, they are used for insomnia. Rosaram is, Silanor, and Buspar. Now, they work differently, each one of them. Now, Silanor has a sedative effect from a histamine 1 blockade. So this is used for interrupted sleep, not for the people who are having trouble falling asleep. This is for interrupted sleep. Whereas Buspar actually acts as a partial serotonin agonist. So this is a very unusual drug that you should know about. It has the anti-anxiety effect, but it doesn't make someone sleepy. It's the only one of its kind like this. So you should know about that. Of the melatonin receptor agonists, they all have side effects. Severe dizziness when taken for some people, and a headache. Not everybody gets it, but when they get it, it's severe. And then these drugs are not drugs of abuse. You cannot abuse these, and they do not become addictive. So now SSRIs, the most important drug right now in mental health probably, so serotonin reuptake inhibitors. They increase the availability of serotonin to the brain. So there's a lot more serotonin there, and it has a lot of good effects because it's more selective. So it doesn't have a lot of the side effects like some of the anticholinergic type antidepressants. So SSRIs are one of the primary first-line drugs chosen for depression and anxiety right now. They do have side effects. It's not like they have the side effects like TCAs, tricyclic antidepressants, or that have the cholinergic side effects, but they have fatigue, they have low libido, they have nausea, vomiting. And because of this, some people have problems staying on the drug. They don't want to be on it. They don't feel good. So they have to start low and go slow and see how they respond. And that's something you should remember with all medications. Start low and go slow on your increments of dosage. So you might recognize Prozac, Zoloft, Paxil, Celexa, Lexapro, and Luvox. These are all SSRIs. Now, I don't expect you to know each of the names of these drugs and what they're good for, but as you can see here, many of these antidepressants are good for panic, social anxiety, general anxiety disorder, that's GAD, and OCD as well. So I expect you to know the categories of the drugs and what they're used for, not each individual drug, what it is used for. I hope that clarifies something. Now, SNRIs are also used for anxiety as well as depression, and they are serotonin and norepinephrine reuptake inhibitors. So they increase the availability of both these neurotransmitters to the brain. And Effexor, Pristiq, Cymbalta, those are the ones most widely used, and they are used, again, for anxiety as well as depression. So when you look at Effexor and you see general anxiety disorder, social anxiety, panic disorder, it's really used a lot for anxiety as well as depression. And also there's something called Pristiq, desvenlafaxine, which is a metabolite of Effexor, but the thing about it is because it has less side effects, it also doesn't work as well for a lot of people. So if they cannot tolerate the side effects of Effexor, but they're getting some relief, they will try them on Pristiq. So you can see there are two choices there. And Cymbalta, it's a wonderful drug used for so many different things. As you can see, GAD, which is general anxiety disorder, but it's also used for people that have nerve pain, like neuropathy or chronic back pain with radiculopathy, and fibromyalgia, because it limits the pain signals that go to the brain. Many people get a lot of relief from this, and the depression that comes with chronic pain can be severe. So it also helps with anxiety, depression, chronic pain, but it's not without its side effects. Sedation, people complain they're too tired, and their appetite increases. So it causes a lot of weight gain, which is another reason people will not stay on the medication. People do not want to stay on something that causes them to be tired all the time and gain weight. So you should be aware of the side effects, but also the benefits of these drugs. So SNDIs, serotonin norepinephrine disinhibitors, a little bit different. There's only one drug in this category. That's Remeron, mirtazapine. And I don't see it used that much, but it is when other things have been tried and haven't been affected. So it increases the transmission, again, of serotonin and norepinephrine. It acts as an anti-anxiety and antidepressant again. It also helps improve sleep because it does make people fatigued, and it helps with some nausea. So the side effects are very, very similar to the SSRIs and SNRIs with the weight gain and sedation. I don't see a lot of people on this. Many people consider one of the side effects, the sleepiness and the dizziness, to be too severe to stay on this medicine. TCAs. These are strictly, TCAs are usually used for depression, not for anxiety. Occasionally they will be used, but more so for this. Tricyclic antidepressants were one of the first antidepressants. And these are the list here you can read for yourself: Pamelor, Elavil, Tofranil, and Alafranil. They are still used for people that have had a problem for years and years, and they've tried different medications, and this is the only thing that works. And it tends to help with OCD a lot, and the depression that comes with OCD and not being able to control it. So it used to be the first line of drug, but it is no longer, because it has so many more side effects. It has a slow onset of action, and if you take too many, it's lethal. Whereas the newer drugs, the SNRIs, and SSRIs, you can take an overdose and it's not lethal. Depends on the amount, of course, but a smaller amount will cause death with TCAs. The other side effects are almost intolerable to a lot of people. It has that anticholinergic I was telling you about, blurred vision, dry mouth, tachycardia, constipation, urinary retention, plus sedation and drowsiness. Very uncomfortable for a lot of people, but a lot of people get so much benefit from their mental anguish that they will tolerate these symptoms. One of the more, or I should say, one of the drugs that have the most type of side effects and the least used are the MAOI, the monoamine oxidase inhibitors. Now, they inhibit the enzyme, and it interferes with the destruction of these neurotransmitters. So there's more available. So it's not just one. Epinephrine, norepinephrine, dopamine, serotonin, they're all more available to the brain to use. So the ones that are most used I've listed below: Marplan, Nardil, Emsan, Carnate. By the way, in an exam, I will always give both the generic and the trade name of the drug. So as long as you know that one of them, it's fine. And I would suggest that you do know the generic, because that's what's on the NCLEX. So keep those in mind. So as I said, it works in so many different ways to benefit somebody, but the side effects can be severe, and there can be a severe emergency related to this, because the body cannot break down tyramine in food when they take MAOIs, and it can cause severe vasoconstriction and hypertension. It can cause a hypertensive crisis. This is an emergency. So tyramine foods need to be avoided at all costs. And if you look at this picture here, this shows the different foods that have to be avoided. Anything aged, any kind of deli meat, sausages, beer, beans, soy sauce, sauerkraut, things that are aged, if you think of that. So other antidepressant drugs include bupropion, which is Wellbutrin and Zybian. And this is used often now, and I'll tell you why in a minute. It acts as a norepinephrine dopamine reuptake inhibitor. So both, you will have more norepinephrine and dopamine neurotransmitters available, but the side effects include inability to sleep. So even though it can help with depression, it causes some problems with insomnia, tremors. Instead of having the weight gain and the increased appetite, it's anorexia and weight loss instead. So the other thing it does that is not a great thing is that it lowers the seizure threshold. So these people are more at risk to have seizure disorders or seizure if they have a seizure disorder, and more at risk to have a seizure during detox of benzos or alcohol. So it's used sometimes. They have to have a trial test at a very low dose first. Then there's also Vibrid. This is starting to be used a little bit more often. It's a serotonin partial agonist reuptake inhibitor. So SPARI, they call it. So the side effects, however, are nausea, vomiting, diarrhea, and insomnia. Since it's not a serotonin reuptake inhibitor, it's a partial agonist, it has different side effects. I don't see this used very often at all. And then trazodone, I see used quite frequently. So you should know about trazodone or Eleptro. Trazodone is used for insomnia quite a bit, as well as depression. So if somebody is on it for depression, it is always taken at bedtime because it makes them so sleepy. And their blood pressure drops as well. So definitely something that needs to be taken at night because of that. And you should be aware of trazodone.